Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Modern and Modest with myself, Noshina Ghani, at the luxurious Aha Avondale Boutique Hotel. Assalamu alaikum wa rahmatullahi wa barakatuh. With me, we are joined today by a dynamic individual who is so passionate about alternate medicine, Dr. Fatima Hansa. Assalamu alaikum, Dr. Hansa, and welcome to Modern and Modest.
Wa alaikum salam. Jazakallah for having me.
Only a pleasure. So before we get into the detail of homeopathy, can you tell us more about Dr. Hansa and your journey to homeopathy?
Well, Noshina, I think for as long as I can remember, ever since I was young, my interest for alternative medicine sparked with my grandfather. And we're talking about maybe even 25 years ago, before alternative medicine was even on the map. My grandfather was interested in things like Reiki and energy healing, iridology, with the eyes. He would buy boxes and boxes of apple cider and keep it at home and give it to guests each time they came to visit, because he had such a strong belief in alternative healthcare, or that there were other solutions than your allopathic medication. And I think since then that has always sort of been embedded in my mind that there was something into this. It did take me a very long time to decide what to study, and by the time I did, I was, you could call a mature student as a first year on campus, and the course is 5 years, so it was a big commitment for me to finally say at 21, okay, I'm going to just start a 5-year course now, and that's sort of how it all began.
So just for us to understand better alternate medicine, we hear of natural healing, but the term homeopathy, what is it?
Okay, with homeopathy, it goes by, the Latin term is similia similibus curentur, which means likes cures likes. So a substance in its crude form, the symptoms that it causes when ingested by a person is the same symptoms that it can cure in a homeopathic dilution. So it's about energy concentrations in medication that then stimulate the body towards homeostasis. So you're not trying to replace anything in someone's body, you're trying to help their body replace it themselves. So you're trying to stimulate physiological mechanisms for your body to now regain homeostasis.
Okay, so you've mentioned 5 years of study for homeopathy. So in those 5 years, what does the 5 years make up of? What does it entail?
It entails a lot. So if you're starting off, even your first year, you're already diving into anatomy, physiology, chemistry. You're cutting up cadavers. So it's the exact same route, the same subjects that you would be studying if you were doing a medical degree. And then, of course, the treatment approach is completely different.
So 5 years of studying, and did you initially open up immediately? How long are you practicing homeopathy for? Okay,
I'm practicing now for 7 years. It is a 5-year course, and then you still need to do a dissertation, so that takes some time. It's quite challenging. You need to be quite patient. I don't think with homeopathy you can have the time frame of I'm going to finish in 5 years, I'm going to finish my dissertation and then just start. It doesn't, the system doesn't always work in your favor, so it's always like back and forth when it comes to research. As much as you are happy with your results, if someone else isn't, you need to go back and forth. So it does take a long time, and I think starting up is quite difficult because nobody knows you, nobody really knows about homeopathy, and just trying to build up a patient base and getting people to trust you is a bit of a challenge at the beginning.
Speaking of challenges, what are some of the challenges you've faced in this field of homeopathy with your patients or with studying? Yeah, just a little bit more about that.
I think when it comes to patients, the main challenge is getting them to be patient with your treatment protocol. We're in such an era of instant gratification and everybody wants results now. Patients often come to you and within that first 2 minutes of meeting you, they tell you we've tried everything and now we're here. So now you need to perform this miraculous instant improvement in their health, and then or else their trust is lost. So I think it's quite difficult just getting people to be patient with their journey of healing.
So would you say that patients come to homeopaths as the last option? Because you mentioned they would have gone to a GP and they would have gone to certain practitioners, and now they need these quick results.
There's definitely that sector that has left you for a last resort. But alhamdulillah, there's a lot of others that will only go this route now. And I think it's such a growing trend towards alternative medicine, and especially with kiddies. I find a lot of moms now are, trying to bypass the antibiotic route and try natural first before they are then going allopathic.
So Dr. Hansa, just to give us a better understanding and our viewers an understanding of the difference, you get natural or alternate medicine, and then you get your allopathic medicine. What makes the difference between a homeopath and say a GP, for instance, as well as your treatment option and the difference in medication?
Okay, just for an example, if a person has allergies, if you go to your GP, the standard protocol would be an antihistamine or some sort of cortisone treatment to try and just stop those symptoms. Okay, the body is not happy, we will stop it. It needs to stop now, not next week. It needs to stop today. Whereas with homeopathy, we're looking at not only your symptoms, it is about holistic medicine. So you're looking at the person at its entirety. So you're looking at causes, what is causing the person to react this way, what is causing that allergy, and why is your immune system being oversensitive to a certain antigen or to a certain stimuli. So when you take all of that into play, you try and better not only the symptoms, but you're trying to better the person's immune response. So the whole physiology as a whole, you're trying to better that. So you're looking at long-term healing, not just a short-term, okay, when this happens, when you have the runny nose, take this and it'll stop. Why is your immune system reacting this way? And that's where homeopathy comes in.
So just to summarize, your allopathic medication would treat the symptom, it's quick, it's effective, and a few months down the line, you're probably back with the same ailment that you've got to stop and treat.
It's a vicious cycle. You suppress it, your body manages that for a while, and then it comes back to you.
And with homeopathy, you obviously take longer because we want to treat the cause so that we avoid that cycle or whatever it is.
I would not even say that it always takes long, but you need to bear in mind, if you have a chronic condition, or if you're diabetic, don't expect to just be off your metformin or your glucophage in a month. It's a long-term treatment protocol. The same with acute. Generally with acute situations, you get quicker reactions. With chronic, you need to have the patients to move with that treatment protocol.
Okay, would you say that there is a space for an individual or a patient to be on allopathic medication as well as alternate medicine?
Absolutely. I think a lot of patients think it's either or.
Yes,
either I'm on this or I'm going natural. But you need to, it's always about listening to the patient and respecting their decisions with their health. And I think especially now more than ever, it's about patient education. Are you taking the time to sit and educate your patient as to why they're on this medication, why their body is reacting this way, how we're going to try and help you move on to a better path?
Dr. Hansa, with studying homeopathy, what type of skills does an individual require to go into that line of work?
I think besides the patience of making it through your 5 years effortlessly, I think one of the big things to me is you need to have some sort of curiosity in your personality, because almost every human being, to me, is sort of like a puzzle, and they give you little bits of the puzzle and you need to kind of fish out what else is going on. A lot of people don't realize so many things are related. They're like, I'm coming to you for my tummy problems. We're not talking about my anxiety at all. And they don't realize it's such a direct
It could be a trigger. Yeah.
So a lot of times having that curious approach brings out the case or your patient's full symptoms and signs, and then it helps you diagnose and it helps with the treatment protocol.
Now, when it comes to homeopathy, we spoke earlier about allopathic medication, and then we talk about alternate medication. So there is alternate medication that you would script to a patient, like we get a repeat script for chronic patients. Is there something like that that homeopaths do? And what type of medication would patients get from you for certain ailments?
Okay, we can also put homeopaths into two categories. You get your classical homeopaths and then you get your clinical ones.
Right.
I'd like to think I'm a bit in between, a bit of a balance. So your classical will give you the one remedy, and that should help you with your ailments, and you come back if you need to. And with the more clinical, you sort of have a more functional medicine approach. So I'm going to give you your homeopathic medication, but alongside that, I'm going to give you supplements, give you herbal adjuncts that are going to assist speed up your recovery process. And most of the time, I like patients to be, if they are on herbs and supplements, I tell them give it 3 to 4 months. For it to actually benefit, for you to see that therapeutic effect of that supplementation or of that herb. A lot of times they just think, well, they're not really sure, especially if it's your first visit to a homeopath, you have no idea
what it's
where
all
the
about
consult is going to go. And often people bring up subjects or topics or life events that they had no idea that they were going to come there and talk to me about. And it's so interesting to always see patients that say, ever since this happened in my life, I've been getting headaches. Or ever since this happened, my menstruation has been all off.
Okay. So very much holistic. It's what you're experiencing in that time, and that would give you an indication as to why the patient is battling with certain ailments.
Yes, holistic, you have to look at not only the present, but also the time frame. Where is that person coming from on their health journey, and where do they want to be? I find it's very important to ask patients also, what are your health goals? Because that's not often something that they think about.
Okay, we'll be back for a quick ad break, chatting more to Dr. Fatima Hansa about homeopathy and alternate medication. Welcome back. With me we have Dr. Fatima Hansa, a dynamic homeopath that will be sharing her expertise and a little more about alternate medication. So Dr. Hansa, would you think that it is more recognizable now, or people are more aware and wanting to visit a homeopath compared to maybe a few years ago?
Definitely, without a doubt. I think even with the influx of patients in the last maybe 2 years, you can see there's such a growing trend towards people trying to better themselves. There's so much, I think we've all evolved into this era of self-improvement and education, and people now more than ever are trying to make the right choices in order to get that longevity and anti-aging effects. We're all trying to, stop the clock and trying to be better now.
I think people are becoming more aware of the natural option that is available, as opposed to the antibiotics or treating your common flu symptoms. They'd much rather treat it from a natural perspective. Now, you've recently attended a very interesting seminar with international speakers. Can you tell us more about what the seminar entailed and how this would benefit our female viewers?
Okay, so the seminar was about women's health. And one of the main aspects was about anti-aging and trying to achieve that longevity in life. And surprisingly, what they've said, with the research out now, they say that when you should have started being better or eating better and living better is from the time you hit puberty. Okay. So from the time you get that hormonal influx of puberty, that's when your puberty until your early 30s is that period where you should look after yourself the most. And most often when we're younger, we think, oh, I'm going to have the burgers and I'm going to have the fast food, and later on I'm going to be good and take my vitamins and take my supplements and so on. But the research has shown now that if you behave earlier in life, you're going to benefit long term.
That must really be challenging, because that's the time where you, like you've mentioned, oh, when I get there, I'll do that, or I correct it, or I've got a long way to go.
Exactly.
So if you don't look out for that period between puberty and 30, this is most definitely going to affect your health, your weight, your skin
Yes.
after 30.
We're not saying lose hope. It's better late than never. I think also one of the biggest things that I took away from this seminar was the trend of intermittent fasting, IF. And I think as Muslims, we're no strangers to fasting. But the difference with this being is that it's following your body's circadian rhythm. So your day-night cycle. And what it is trying to create a period or a window of eating for a certain hours and then fasting for another amount of hours. What most people do or can manage, I would say, is what we call the 16-8. So you have an eating window of 8 hours and then you fast for 16 hours. So essentially how you would do this is you would delay breakfast, so have a very late breakfast, as much as we've been taught that breakfast is the most important meal of the day, and so now all that has changed. And so you start with a late breakfast and you have a very early supper.
So coming back to starting with that late breakfast, we all have to be up in the morning, send our kids off to school, we've got to get to work. And it's habitual to grab something on the go in the mornings. Now, when you say delay that meal, does this mean that we can't even have a cup of coffee,
Nothing.
fresh juice, no liquids at all?
No, you're allowed water. Nothing else that is going to stimulate metabolism. So no caffeine boost, no teas. You wait. So if you're looking at an 8-hour window, the easiest I think would be maybe a 10 o'clock to 6 p.m. fast.
Okay.
So early supper, and that does sound manageable. And I tell patients also, if you can't manage it every day, do it twice a week, and then do it thrice a week, and then do it only on weekdays. And what exactly happens is when you're going to sleep without food in your stomach, there's no blood supply that's focusing on digestion. It's focusing on repair. And during that sleep time, that's when your body should be resting, you should be repairing, you should be rejuvenating. And it does make so much sense if you think about it, because when you keep putting food into your system, you're not giving your body a chance to deal with other inflammatory factors or any other chronic conditions that it needs to be repairing.
So coming to the fasting, would you say for a person that's never done this, would you start out with once a week and gradually increase? And is this something that you should be doing long term, or is it just for a short period of time? Or maybe I could do it once in 3 months. I feel like I need a detox. What would you recommend?
I would recommend you start off with 2 days a week and then you build on that. And I think people eventually see or feel the health benefits of that. Because like I said, you're looking at small, sustainable lifestyle changes. And that is something, the whole idea about intermittent fasting, what makes it so easy is that we're not telling you what to eat, we're just telling you when you should be eating. And that's quite a dream to some people. But I think over time, when you feel the benefits of good health choices, you automatically start choosing better things for your body.
So at your practice, being a homeopath, what type of ailments would you say you tend to deal with more often than others? And do you see patients that have issues with weight or with skin? Seeing that you've been on the seminar, this is what they've discussed, quite strongly linked to alternate medicine. What patients do you see at your practice?
I think firstly, somehow, I think being a mom, I've kind of gravitated towards a lot of pediatrics somehow. So I'm much more comfortable treating them. And luckily, I think a lot of moms now are pushing for that alternative.
They prefer
health.
that option as well.
For just a runny nose or even, just a high fever and things. They're actually trusting alternative practitioners now with their children, which is really great in that we're starting them off with alternative medicine. The other aspect, of course, I think is your dermatology cases, because skin has always been something that people are horrified about if anything goes wrong. So there's a lot of those, and I would say a lot of them are challenging, because that too is a long-term protocol. You're not overnight in a week going to start seeing the improvement. But those that have stuck with it have benefited. So there's a lot of dermatology cases.
So what would you say are the most challenging issues as women? What would you say, how would you say we affected when it comes to just overall health and well-being?
I think definitely when it comes to women, it just screams hormonal imbalances. And it happens, we're not just talking menopause, every age, every time, there's always something going on. I think women are much more sensitive to changes. And when anything triggers us, automatically there's a cascade of reactions that are going on, and things kind of fall out of sorts. Very often patients come to me with irregular menstruation or fertility issues, and they don't relate it to stress. They don't relate it to what else is going on in your body.
So is that where you could come in? And when you chat now about fertility issues, would you say you treat just the female, or do you have treatment for both males and females?
Ideally, you want to treat both. You want both to have optimal hormonal levels for conception. But most often, men will only, come to you when they're in dire need of treatment until it's literally a last resort. So very often you're just working with the female, and who has the most complex physiology when it comes to hormonal treatment. Very often stress is a massive underlying factor. And I mean, how often have you heard of people that have been trying to conceive, and when they finally given up and stopped putting their pressure on themselves, then they fall pregnant. Or you find that they adopt a child and then they're all happy,
Yes.
and then they fall pregnant.
That's true.
So, it's all about the foundation phase when it comes to hormones and balance and regulation.
Okay, so just before we wrap up, Dr. Hansa, what message could you give our viewers? I mean, there's those that are very happy to visit a homeopath and those that don't really trust or believe in a homeopath. How would you get these individuals to actually visit a homeopath?
I think your best route is that word of mouth advertising. If you look after the patients that you have well, they will convince their family members to come and try it out, because of the benefits that they're feeling throughout.
Okay, well, thank you so much for being on our show. That was Dr. Fatima Hansa, a homeopath who's very passionate about alternate medication. Welcome back on Modern and Modest, and with us today we have audiologist Akira Haribaran. Welcome, Akira, to Modern and Modest, and it's such a pleasure to have you on our show.
Thank you for having me.
Okay, so Akira, with audiology, what's gotten you into becoming an audiologist?
So when I was still in high school, they always do this job shadowing kind of thing, and I shadowed an audiologist. And for me, that moment when there was a lady who couldn't hear and we put a hearing aid on for her and right in front of me, that was amazing to me. And that really got me excited about giving somebody their quality of life and giving somebody their hearing back.
So how long are you practicing audiology for?
Okay, so I've been an audiologist for 2 years now. I did a year in government and now I'm in private, and both of them have been so rewarding.
So the start and the inspiration for you was putting a smile on this individual's face. So practicing now for 2 years, the study, what does it take to become an audiologist? How long does it take for one to qualify?
Okay, so here in KZN, which is where I studied at the University of KwaZulu-Natal, it's a 4-year degree with honours, and then you do a year of compulsory community service, and that is, again, just to give you your experience and things like that. It's a very hands-on degree, so you do a lot of clinical practice as well as theory, so it's been very exciting.
Okay, Akira, so becoming an audiologist, why have you chosen to become an audiologist?
So I've always known I wanted to help people. I've never wanted to have an office job and sit behind a desk all day. So in high school, as they do, you have to go out and do work experience. I actually went and shadowed an audiologist. and I thought it was amazing. I thought what she's doing is so different and it's so hands-on. And then they had a patient come in who actually had a hearing loss, and she in fact got a hearing aid right in front of me, and when she put that hearing aid on, her face just lit up. And I knew in that moment that that's what I want to do. I want to give somebody their hearing back, and I want to, give them a better quality of life. And it was such an amazing experience. I was hooked from that initial job shadowing.
I guess giving back, no one would think of, I want to give someone their hearing back. You think of, I want to be able to help maybe in giving someone their sight back, but very seldom do we discuss impaired hearing.
Exactly.
Or I need to go and visit my audiologist and have my hearing looked into. So you then decided, okay, this is what I want to do. I want to be giving back. I want to become an audiologist.
Yes.
So how long did it take you to study in qualifying to become an audiologist?
Okay, so I studied here in KZN at the University of KwaZulu-Natal, and they have a 4-year degree. It's a degree with honors, and basically it's a very hands-on degree, so you're doing a lot of practicals along with the theory. So that was nice. That was an interesting learning experience for me. And then you do a year of compulsory community service, and that also, it gets you there, it gets you in the community, it gets you looking at cases that you would have never even known existed, because I've been in the city my whole life. And then, so it's a very nice experience, especially because you get to meet so many people along the way.
Would you say in that time that you were doing community service or currently in your practice, when it comes to hearing loss, are you seeing older patients that come through to you, or do you get the younger ones that have issues with hearing as well?
You would think that it's a problem that only the older people have. You would think that, as you get older and it's a sign of old age that you have a hearing loss, but no, it affects all sorts of people because there's so many different causes of a hearing loss and there's so many different symptoms of a hearing loss. So you get kiddies who have sort of ear infections, and they have now a hearing loss associated with that. And you've got the older populations also. So it's a very, very wide age range that can have a hearing loss or can experience problems with their hearing.
So Akira, how long have you been practicing audiology for?
So I've been practicing for 2 years now. As I said, I did my community service, which was 1 year of government, and now I'm in private. And both have been so rewarding and so different and so challenging in their own ways.
So I was researching a bit about audiology and just trying to understand better what audiologists do and what it entails. And I came across the word balance, and I would never have thought balance would be associated with your ears. So could you share with me and the viewers, how does balance come and how does it play in the role of hearing or your ears?
Okay, so basically the ear has 3 parts to it. Your outer ear, which is the part that you can actually see. Then you've got a middle ear, you've got an inner ear. The inner ear is in charge of your 2 main functions, which is hearing and then balance. So there's a structure in the middle ear that actually is in charge of your balance. And when you have balance problems or issues with imbalance, it most likely is caused because there's something going on with that structure in the inner ear. And that could be caused by trauma to the ear, so having a nasty fall or an accident, or it can be just through the natural aging process.
So you mentioned 3 parts to an ear. We know the outer part, and we know, okay, you've got to be careful when it comes to your eardrum and don't put anything in your ears.
No
I mean, growing up as a kid, I know that. But also, as we were growing up, we would, when you get sick or you're not feeling too good and you'd visit your doctor, and I know very often they'd chat about a middle ear infection. So you chatted about outer ear, inner ear and middle ear. So can you share more about what is a middle ear infection?
Okay, so a middle ear infection is basically a buildup of fluid in that middle ear, okay? And for various different reasons, that fluid can't drain by itself, so it actually causes an infection. It's like, for example, if you have water just sitting anywhere, it's going to cause problems. So similarly, if you've got fluid in that middle ear, it's going to cause problems. So a lot of the time, it happens in kiddies. They get the flu very often, they're going to school, they're picking up different things, and so that fluid drainage becomes more and more difficult. It does happen in adults also, and that's something that if you're getting chronic middle ear infections, it can actually cause a hearing loss also eventually. So that's something very important to get treated, get intervention for that, because you don't want it to lead to a hearing loss later in life.
So when it comes to fluid, the middle ear infection related to fluid, would you say that's where grommets come in? Because grommets is very common amongst kids. So what are grommets, and what do grommets do for an individual?
Correct. So grommets is actually a way that we can drain that fluid out of the middle ear. So it's something that's generally inserted into the eardrum to give sort of the fluid a little funnel to come out. And that again is not a permanent solution. You'll often find, parents will see that the grommets have popped out, which is completely normal. And completely, it's part of the process. So that's there to drain that fluid and prevent that infection from actually getting worse.
So would you say grommets, is that just needed or required for kiddies, or do adults also use grommets?
It can be in both, and then your ENT, your ear, nose and throat specialist will actually give you further advice on that if you're having chronic middle ear infections as an adult also.
So you mentioned now that as your kid grows, the grommet would pop out on its own. But then again, if you have repetition of middle ear infection, that could be dangerous because it could lead to impaired hearing. Correct. So how would one tell? Are there any symptoms associated with, I need to probably go in and have my grommets put in again?
Yes. So again, if your kiddie is tugging on the ears and complaining of a lot of pain in the ears, that could be a sign that the infection is coming back. Otherwise, also if the teacher is complaining that, maybe the child's not doing too well in school, then that's a sign that maybe they're not hearing properly. Again, you can tell as a parent, your child's not hearing you correctly, not coming when you call them, things like that. So definitely if you're starting to notice a hearing loss again, and again pain is the number one indicator. A kiddie should not have earaches. So then you would take them back to the ENT or your doctor or your audiologist and get them checked out again.
You mentioned now, when you're calling your kid and when they can't hear you,
yes.
That could be an indication of hearing loss. So what are the symptoms or signs associated with hearing loss, apart from not being able to respond?
And I have to just say, with kiddies, it could be selective hearing. It could be that their cartoon is a bit more important than you are at that stage. But definitely if you're misunderstanding words, if you are for a sort of a younger child or a teenager, if they're not doing too well at school, you would then go ahead and speak to their teacher and then take them for a hearing test just to rule it out. And then for sort of more teenagers, young adults to adults and older adults, if you're misunderstanding people, if you are finding that somebody's talking to you and you're giving them the incorrect answers, if you're feeling like everybody's mumbling around you, but everybody is talking clearly to you. There's such subtle differences. Sometimes it could be the difference between the word thought and then the person actually said fought. So that T and that F sound, but it changes the entire meaning of the conversation.
Yes.
And then I tell my patients all the time that a lot of the time your family and your loved ones around you will bring it to your attention first that you're having a hearing issue or hearing loss or problem. Because they'll always tell you, you're not hearing me properly, or you can't, you're not answering me properly, or whatever the case is. And that causes a lot of frustration with your loved ones also. So that's also a sign, go and get your hearing checked. Other smaller things like you may be turning up the volume of the radio a little bit louder, you may be putting the TV loud and everybody else is telling you, please put it softer. And then also over the telephone, you may find also you're favoring one ear over the other.
Yes.
That means that ear is actually a little bit better than the other. So small things like this. Hearing loss is such a gradual thing. It happens so slowly over time, unless it's a sudden thing like a head trauma or constant ear infections, but otherwise it happens so gradually that it's almost hard to realize. You don't just wake up one morning and can't hear everybody.
Sure.
So it's one of those things, if you are struggling a little by little, it's good and it's worth it to get your hearing checked out sooner rather than later.
Would you say that an individual that speaks very loudly as well has probably have issues with hearing?
Correct. Correct. One of those first signs are that you actually increase your own voice because you can't hear yourself speaking.
Yeah.
So that is one of the things. Besides not hearing correctly the people around you, you can't hear yourself correctly also. And you'll also be asking for a lot of repetition. So you might be getting frustrated because you keep having to ask, please repeat that, what did you say, excuse me. So all of those things can lead to the sign that you have a hearing loss.
Okay, so Akira, we chatting about fluid and how this could affect your hearing. For people that work in a very noisy environment, can loud sounds also affect your hearing ability?
Yes, exactly. So one of the most common types of hearing loss that we actually seeing in people working in industrial areas, or even people working in recreational settings like DJs, people who work in bars and clubs and things like that, they actually have something that we call a noise-induced hearing loss. So that is basically a hearing loss caused by high volumes of noise, whether it be loud music, especially teenagers who listen to music with earplugs, or whether it be working in an industrial type of environment like factories, especially on the factory floor. You need to be wearing hearing protection. You need to be wearing some kind of earplugs or earmuffs to block that sound from coming in, because constant loud noise can actually cause a hearing loss in the long run. And especially when you want something custom made to you, that's when you can go to your audiologist and they can give you a wide variety of different types of earplugs. You've got earplugs even to help you with swimming. So if you find that you have lots of ear infections and things like that when you go swimming, or even sometimes just having a normal shower or bath, your audiologist can actually help you by getting a specific type of earplug. If you're just troubled by your husband snoring at night, you can get a specific type of earplug. And then again, for that noise, that industrial noise, that recreational noise, all of that, you should be protecting yourself against, because it can lead to a hearing loss in the future.
Okay, we'll be back after a quick ad break with Akira Haribaran. Welcome back on Modern and Modest, and with me we have Akira Haribaran, an audiologist. So Akira, your practice is called Kind to Hearing. Can you tell us more about Kind to Hearing?
Okay, so Kind to Hearing is a group of audiologists. We have over 28 branches countrywide, so wherever you are, you can find one of us. So in KZN, we have 5 branches, one on Doctors on Kawi, which is in Morningside, one in Hillcrest, Durban North, Belito, and Amamzintoti. So basically, wherever you are in KZN, you can find us.
So is Kind to Hearing just based in KZN?
No, so we're countrywide. We've got branches in Gauteng, Port Elizabeth, Western Cape. Wherever you need us, we're there.
So being a group of audiologists, what type of services do you provide?
So I think our most famous service is that we offer free hearing screening tests. Now, free hearing screening is just a basic test of the ear, and it's really nice because it gets you to identify if there's a problem or not. And then from there, you know where you need to go in terms of further diagnosis. Besides that, we offer a full diagnostic test, which tests the outer ear, the middle ear, and the inner ear. So as we were talking about ear infections, there's a specific pressure test that we can do to see if there's an active ear infection in the ear. And then, of course, we test the inner ear to see how your hearing is. Other than that, we have a wide range of noise protection that we can offer you. As I spoke about, the different types of earplugs that you can get. We then offer tinnitus counseling also. Now, tinnitus is a ringing or a buzzing sound that you can have in your ear. It can be quite frustrating to constantly have that ringing in your ear. And it is something that's not curable at this stage. So we would give you different ways to manage that tinnitus. Besides the actual diagnosis and identifying of hearing problems, we then have so many different varieties of ways that we can actually help you rehabilitate your hearing loss. And one of the main ways we do that is using hearing aids. So with technology, you know, it's amazing what these hearing aids can do. They are so discreet, they're so small, they can provide you with such natural sound quality. It's actually amazing. And nowadays you've got streamers that stream directly to your cell phone. You can change volume on your cell phone. You can stream directly from your television, so you're getting that absolutely pure quality of sound. And then we also give you different remote controls that you can use.
Wow.
So there's so many different options to suit your specific lifestyle. You know, obviously, especially when you get a little bit younger patients coming in, they need that technology, and they need to maintain their active lifestyle, and a hearing loss shouldn't be holding them back. So Kind Hearing actually specializes in getting you a good fit to your actual lifestyle. And then besides that, we have a wide variety of accessories. We've got batteries for sale. Anything that you need to clean your hearing aid, we've got it. We also provide you with free hearing aid cleanings.
Wow.
So you just drop off your hearing aid, we clean it for you. And then, of course, anything else to service your ear. So, for example, sweet oil or any other things that you need for your general ear health and care, Kind Hearing's got you covered.
Okay, so when it comes to hearing, how often should one go and have your hearing screened?
Okay, so especially if it's a child, the minute you suspect a hearing loss, you need to take them for a hearing test. And if it's a child with chronic middle ear infections, things like that, then you definitely need to be taking them every 6 months. You want to get ahead of the hearing loss if it's starting to occur. An adult and getting into the more older populations, you should be having your hearing tested at least once a year. So your hearing tests are not something that you would do at your annual medical checkups.
Sure.
You know, you'd get your blood test, you'd get your your
Yes.
blood pressure tested, everything, but not your hearing. So that's also something, you know, your general physician wouldn't be doing that for you, so you would need to do that on your own. Even if it's just the basic screening test, it's good to get it done at least annually so that you stay ahead of the problem, because the sooner you detect a hearing loss, the sooner you can actually get intervention and the better it will be.
So when you chatted about hearing aids, do you get different types of hearing aids for certain conditions? Maybe my hearing is worse off than the next person's hearing. So do you get different types of hearing aids?
Yes, so there's a number of different types of hearing aids, a number of different styles, and a number of different power options. So if you have a very mild hearing loss compared to somebody with a very severe hearing loss, I wouldn't be giving you the same hearing aid. Okay, Kind Hearing specifically deals with 3 amazing brands of hearing aids: Sonic, Interton, and Resound. These are amazing products that give you the best natural and most comfortable quality of sound that we could possibly get in South Africa at the moment. So it's very, very high quality, very, very good. That's going to, you know, it's going to work for you. You're not going to have to work for it.
So coming back to hearing aids, an individual wakes up in the morning, puts on the hearing aid until time to go to bed.
Yes.
So using a hearing aid every day, you mentioned you offer services of cleaning your hearing aids. So how often should one clean your hearing aids with Kind Hearing? And then at home, what would they do if they can't always make it to you to keep those hearing aids clean?
Okay, so wax is the #1 cause of needing to clean a hearing aid. So every day a person with a hearing aid should actually be cleaning their just the part that sits in your ear, just with a tissue or a cloth. It should be noted that no water should be going on the hearing aid. So even when you're going to have a shower or a bath, take off the hearing aid for sure. And then, you know, whenever you're in a center that has a Kind Hearing, just stop by and we'll clean it for you. It's more of something that you can do whenever you want to. Probably about once a month if you can make it to us. Otherwise, just whenever you're in, come stop by for a free cleaning, or come stop by to just maybe you need to get re-familiar with the cleaning process and the cleaning procedures, because the better you look after your hearing aid, the longer it's going to last you, and the better the sound quality is going to be also.
Sorry, my next question with you, we're heading now into summer with November and December coming up, and you're going to find individuals going out to the beach. And you mentioned now not having any water get onto the hearing aid.
Yes.
So what happens if a person decides to go to the beach and can't hear well?
Yes.
What do you do then?
I love that you also mentioned Durban and the humidity, because even sweat can affect the hearing aid. So what we do is when you purchase the hearing aid, we give you a dehumidifier, which is a little tub with a little yellow pill, and you would then put your hearing aid in with it. And what that does is it draws out any moisture from the hearing aid. So any splashes of water, any sort of sweat or anything from the humidity, that can be drawn out with that dehumidifier. And you know, the good thing about all our hearing aids is that they are nano coated. So a little bit of splash, a little bit of rain, a little bit of dust is not going to hurt the hearing aid, as long as you then take care of it correctly when you leave the beach and when you go home and you put it in that dehumidifier there.
So how often does one need to get a new set of hearing aids?
Okay, so your hearing aids, it depends on how you look after them. They can actually last you between 2 to 5 years. So as long as you're taking care of them really well, as long as you're going back to your audiologist and getting your hearing tested and then reprogramming the hearing aid accordingly, your hearing aid can last you a very long time.
Okay, so just coming back to how to keep your hearing aids clean. How does an individual, how do we clean our ears? Because we know we can't be taking earbuds and popping them in. So how would you say we could keep our ears clean?
Yes, I hate earbuds. You know, I've seen, it's not something that the average person can see. You can't see into your own ear. So the danger with earbuds is that you're then pushing wax, and you're even pushing the earbud itself very close to your eardrum, because you can't actually see how far in your eardrum is. So I've seen a lot of the time, you know, people hurt their eardrums. The ear canals inside are actually quite red. They're quite traumatized, because yes, it feels amazing to put that earbud in, but it is actually a very sensitive part of your body, and you don't want to hurt that eardrum, because that again is a permanent damage. The other thing is the quality of earbuds are not good. So I can't tell you how many times I've had to remove the little cotton that's on the end of the earbud, because that then gets stuck in the ear. And then people use other things like matchsticks and hairpins, and you know, all of that is very dangerous for your ear, purely because you cannot see how far you're pushing things in. So I would recommend that if you are having blocked feelings, if you feel like there's wax in your ear and you can't get it out, visit your audiologist and let us take care of it, because we can actually do that removal for you. So we can have a look, we can see exactly where your eardrum is, see where the wax is, and syringe your ears or remove the wax, or give you things like sweet oil to manage the wax buildup, rather than you taking care of it yourself.
So what does sweet oil do for your ears, Akira?
So that would soften your wax, especially if the wax is a little bit hard. Wax is actually self-cleaning. It will come out by itself. Just by swallowing, coughing, chewing, wax actually gets pushed out of your ear. So sweet oil would then soften any hard wax that's in your ear, and it would come out by itself. So when you're having a shower and you just wipe the outer of your ear, it comes out. But sometimes, you know, people do have problems where they have excessive wax, and that is when we can then remove it with either by syringing or by actually cleaning out the ear for you.
Okay, so Akira, just before we wrap up, how can our viewers get in touch with Kind to Hearing, seeing that you're now national?
Okay, so Kind to Hearing, we've got an amazing website. There's actually a self-test that you can do on the website. So if you've got a set of headphones at home, you can do that basic screening of the ear. Our website is www.kind2hearing.co.za, and the 2 is a number 2, so it's Kind to Hearing. Also, you can contact our toll-free hotline, which is 0800 100 200. And then if you want to contact me directly, please feel free to drop me an email on Akira, that's AKIRA, at k2h.co.za.
Okay, thank you so much for being on Modern and Modest, and that was indeed informative.
I'm glad, thank you.
I now have a better understanding of why we need to balance our ears.
That's so good.
All right, that was Modern and Modest with myself, Noshina Ghani. Same time next week on Modern and Modest.